just kind of a look at what lithium toxicity looks like. So what was our level? 0.6 to 1.2. So we've got some signs of toxicity. So it kind of results in this like neurocardiac realm. So, you know, we get up to 2, we've got some confusion, these muscle fasciculations. 2.5, we've got this clonus, which we'll talk about with serotonin syndrome. So movement can get into coma. 3, cardiac arrhythmias and big seizures. And then 4, cardiovascular collapse and death. So the next one's depression, and depression is different from bipolar, right? Depression does not have periods of mania. That's huge in its definition. Depression can look like low mood. It can look like increased or decreased appetite. It can look like increased sleep or decreased sleep. It can look like increased kind of movement, twitching, or just like no movement at all. Low mood, lack of pleasure, loss of interest. And we can get all the way up to suicidal ideation. So depression really can impact quality of life. It affects a lot of people. If you're suffering from any of these symptoms, we have WellConnect on campus. I'll post a link to that because I think that's really important. But depression is manageable. And the goal is to treat and get complete symptom relief. So 2 kind of ways that we address this is with therapy. Cognitive behavioral therapy is a big thing with CBT or cognitive behavioral therapy. We look at how thoughts impact our behaviors and how that affects our overall being. So, you know, if you're feeling worthless or feeling down on yourself, that type of therapy would specifically address those thoughts. And by addressing those thoughts, it would kind of lead to an overall increased quality of life. So that's effective. And then we have all these medications. Obviously, we're in a pharm class, so we'll talk about those. The medications are also effective. When combined therapy and medications, we get the best result. So we'll talk about these medications. Tricyclic antidepressants are actually the first antidepressants created. They are used not really so much for depression. We use them for headaches. So kind of headaches that aren't manageable with Tylenol, ibuprofen. Could get these effective for neuropathic pain, and then effective also for insomnia. These medications make people very, very drowsy. So definitely want to take at bedtime. So these are things like imipramine, nortriptyline, doxepin, amitriptyline, and desipramine. So the triptyline and pramine are probably going to help you in terms of those 2 endings. And then doxepin is kind of just like all by itself. So these medications can have some side effects called anticholinergic effects. You'll see those down at the bottom. So anticholinergic effects are with a lot of different medication. It's specifically with this cholinergic pathway, and we'll talk about that a lot next week. But tricyclic antidepressants can have these effects. High yield to know what anticholinergic effects are. So these are can't see, can't pee, can't spit, can't poop, is how I remember them. They basically overall dry you up. They make everything really dry. So I want you to tuck that away. Tricyclics have anticholinergic effects. Another thing to note about tricyclic antidepressants, if taken in overdose, they are very, very fatal. This is not saying if you took a bottle of Zoloft, which is an SSRI, you wouldn't die, but which I apologize, I speak of this in a kind of candid manner. But tricyclic antidepressants are very lethal. If you have a person who's experiencing any sort of suicidal ideation, you would want them to not have these medications at all. If a patient takes these, I mean, I saw one overdose, probably the worst overdose I ever saw, and the patient was perfectly fine. I mean, she was okay. She was able to walk from the paramedic's cot to the bed, able to get her hooked up to vital signs. She was kind of hysterical, and then it just, probably over a matter of like 30 minutes, it went completely downhill. She needed to be paralyzed, to be intubated, because she was so, she just really had this hyper movement. It was like, it almost looked like seizure, but she was awake. She had these cardiac abnormalities. She was really, really sick with that. So without that intervention, she probably would have passed away at home. So be mindful of that. This next group is MAOIs. I think these are really high yield too. MAOIs are monoamine oxidase inhibitors. So we remember MAOIs don't do well with anything else. They're not friendly to anything else, specifically things that are going to increase any of these neurotransmitters. So like you can't take cough syrup. So if you were taking Robitussin, which has like some serotonergic properties, can't do it. If you were taking Demerol, Pyridine, Tramadol, any antidepressant. So most drugs you're going to think, I'm probably going to wait 14 days after taking an MAOI. That being said, barely anybody's prescribed an MAOI, so that's really good. But it is something very dangerous, so I need you to know. Specifically, so write this down, MAOIs and tyramine do not go together. They hate each other. MAOIs and tyramine. So I'll tell you what tyramine is. Tyramine is an amino acid and it occurs in these foods. So look over to the right. I think of these as fancy French foods. So these are cured meats, aged cheeses, anything fermented, yogurts in there, wine, draft beer, and then any of these nightshade vegetables. So tomatoes, eggplant, avocados on there, chocolates on there. So think of all these things you can't eat, right? So you have this huge list of foods you can't eat that probably make you very happy to eat them. So that's going to be awful. What happens, and I want to take this, it's okay, no tyramine and MAOIs, but I want to take this a step further. If MAOIs and tyramines are consumed, patients will get a hypertensive crisis. That means their blood pressure is going to shoot up crazy high. MAOIs and tyramines do not go together. And then MAOIs themselves have a ton of side effects. 3 specific ones are isocarboxazine, phenylazine, tranylclopramide. I think if you kind of remember those are MAOIs, you can't do MAOIs with any of these foods. That's going to be really helpful for you. Next one is SSRIs. These are serotonin, selective serotonin reuptake inhibitors. These are a very, very common class of meds. I would beg to bet that a lot of you probably may have taken these, know somebody who has taken these. These are very common medications, which is fine because depression should not be stigmatized. So these medications are really useful in depression and anxiety, among other things. What happens here is we make more serotonin available in the synaptic space. As you can see, the synaptic space is the area where the serotonin touches the receptors. We want the serotonin to go with the receptors, right? That's what produces an effect. It's an agonist. It goes with the receptors. But sometimes with depression, patients have this increased reuptake, so that original neuron, that pre-synaptic neuron, is taking up all the serotonin. It's taking it back too fast through that reuptake pump. So what the SSRI does is it sits on the reuptake pump and prevents that. It inhibits the serotonin from going into the reuptake pump, so it allows it to stay in the synaptic space longer and have an action on those receptors. Serotonin syndrome does have a black box warning of increased suicidal ideation and completed suicide. This is more among ages 18 to 24. I don't know why that is. Know that serotonin, if anybody is complaining of increased depression, you're always going to ask about suicidal ideation. I would probably ask them about suicidal ideation at every single visit. Anytime somebody walks in the ER, I ask them if they're having thoughts of harming themselves. Every single one. That is the standard. So really have a high suspicion for increased suicidality in these patients, any age. SSRIs are used for anxiety and depression, as I listed. Some of them can be used for OCD, bulimia, so a lot of different psychiatric conditions really are dependent on serotonin. These drugs, I'm trying to think of endings that may help you. Tine, T-I-N-E, Pram, P-R-A-M, lean, and mean. So maybe that's going to be helpful. Citalopram, fluoxetine, which is Prozac, fluvoxamine, which is Luvox. That is only indicated for OCD. You don't see it too much, but I think it kind of looks like Prozac, so that's how I remember. Paroxetine, and then sertraline. These medications, the biggest thing is some of them cause sedation, specifically Paxil, and then they can cause weight gain, and they can cause sexual dysfunction, which looks like inability to have an orgasm, decreased desire for sex. So that can be disruptive. These drugs can also have QT prolongation. You're going to see that as a side effect in a lot of meds. So I wanted to show you what that looks like. QT prolongation is an area of your heart rhythm. So when you see it on an EKG strip, we have this rhythm over here. So let me just mark this. And this is definitely more of a med surg type thing, but we have your QRS complex and then your T wave over here. If this is really long, what can happen is when you repolarize, we get kind of a hit. So it hits, which really the biggest thing I need you to know, if somebody has QT prolongation, we give them a QT prolonging med, they develop VTAC. So that's a big deal. That could lead to death. So that is really important to know, that it could be dangerous. Now, I see patients with EKGs who have QT prolongation. It's never really super concerning, but if a medication specifically has a higher rate of QT prolongation, we would want to avoid that. All right, so next we have serotonin, norepinephrine reuptake inhibitors. So these obviously do serotonin and norepinephrine. They're good for anxiety, they're good for depression. There's some panic indications here, but they're also good for fibromyalgia and other type of pain. So fibromyalgia is a pain condition that is characterized by overall pain, increased sensitivity, and decreased quality of life. So these medications are helpful. Really the big ones are venlafaxine and duloxetine. Pristiq is an isomer of Effexor or venlafaxine, so it sounds exactly the same. So you may see these medications not only indicated for anxiety and depression, but also pain.